According to the Alabama Department of Public Health's Maternal Mortality Review Committee, nearly 40 women in the state die within 1 year after delivery. Due to structural racism, the toll for Black women is much greater, with a maternal mortality rate 3 times that of their white counterparts. The time is now to expand Medicaid postpartum coverage. This matters to our mental health and our holistic wellness.
It shouldn't be such an uphill battle for people to get the proper health care that they need.
The bottom line, I believe, is that this country of so much wealth and prosperity, there should be no reason why any person, let alone women and their children, die.
Before I figured out I was pregnant, my birth plan in the beginning, I wanted to have a home birth because I don't like needles. I didn't want to get an epidural.
One of the biggest issues that I see is access to equitable care. Just being able to have the same type of access to care that we know would make a significant difference as far as their birthing outcome is concerned.
I ended up calling our benefits services for my job and just asking them just general questions about what the insurance covers as far as like maternity care. Do they cover like deliveries, stuff like that? And basically they told me that they have a wellness coverage. The wellness coverage only covers 6 doctor visits annually. And I was like, I didn't know that you can actually put a number on how many times you can go to the doctor in a year. And how they came up with 6, I don't know. Around the end of March going into April, I was coming up on that 6th doctor visit appointment like cutoff. So I walked in the office and the nurse at the desk, she was like, hey, we talked to your insurance and they do not cover maternity deliveries. And she was like, well, you can go look for insurance to cover it, but if you can't do that, you're gonna have to give your doctor $3,000 by your 30th week. So my 30th week pregnant would have been in like July, and this was April.
In Alabama, like across this nation, need access to healthcare, healthcare coverage and treatment. And healthcare coverage cases, it really does provide the kind, it eases the burden, while pregnancy and possibly extension of coverage postpartum would be another really good opportunity for us to save lives when it comes to Black mortality. I think that it's critically important to health outcomes and to the quality access to quality, affordable health care that we in Alabama expand Medicaid. We know that if we do, 300,000 Alabamians who currently are not covered would have health insurance. And I think that that's a worthy goal. And especially when we think about the fact that Medicaid in Alabama is so bare bone minimum, that what we're talking about are people who really can't afford it, but they work each and every day. So it's really the working poor that we would be able to uplift if we expand Medicaid.
When I had my baby in October, I didn't have income or anything. So somebody said, hey, you should apply for Medicaid. I applied and I qualified. It really helped because she had to go to the doctor, got prescriptions, went to get the prescriptions filled, and the pharmacist, he was like, oh, well, you don't have to pay for anything. That was like a, whew. Anything that you do legislative wise or anything to expand Medicaid is going to, positively impact Black maternal health. Expanding Medicaid is not only going to affect the poor community, it's going to affect middle class. It's going to affect everybody, and it's going to affect people in a positive way.
Right now, the Alabama legislature is debating whether or not to invest in healthcare that can save new parents' lives. There's a bill before them, House Bill 360, that would extend postpartum Medicaid coverage from just 2 months to 12 months, the real postpartum period. It's unacceptable that we allow our maternal mortality rate to increase and increase, especially when we know what the answer is: more access to health care. So we need your help. We want you to call your legislators. To contact the House of Representatives, call 334-261-0500. And to contact the Senate, call 334-261-0800. You'll be connected with an assistant. Tell them your name, where you're calling from, and that you support House Bill 360. Your advocacy matters.